all cross-border truck operators to abide by the protocols on the ministry's website. Employers are encouraged to advise their staff and general public accessing their workplaces to adhere to the laid down containment measures, which by now are very familiar to all of us. We'll continue to repeat it: hand washing, keeping physical and social distance, observing cuff etiquette, avoiding face touching, proper use of face mask, avoiding gatherings, and staying at home as much as possible if one can do that. Turning to our COVID situation today, we have recorded the highest number of positive cases since the pandemic struck in our country. I say that with some level of qualification because today we have tested a sample of 6,024, and among these samples we have found 213 positive cases. The qualification I refer to is that you can note that the 6,000 is a large number. I think it's probably the largest one-time number that we have tested. And the positives, 213, also looks high. It's the highest we have recorded, actually. But we must also look at this in the context of the number of samples that we have tested. So if you look at it as a ratio, we have been testing approximately 2,000, roughly 2,000 samples a day. And this is what has taken us to the three-digit figures of 100 and just above 100. If you look at it in that relationship, this number is not that alarming because it still translates to about that level we are seeing of about 70 positive tests for every 2,000 tests tested. The reason why the number is huge that we have tested is because, if you will recall, we have told you before that we had some backlog of samples which came up because we didn't have the reagents. We now have the reagents, and we've been able to clear up this backlog, some part of this backlog, which accounts for the large number of samples tested and gives us those number of positives. This now brings to 4,257 the number of positive cases in the country. And the cumulative number of tests that we have carried out so far is 130,498. Out of the positive cases, 198 are Kenyans, 15 are foreigners, and in terms of age, in terms of gender, 151 are males, 62 are females. In terms of age, the youngest is 1 year old, the oldest is 73. By distribution in the counties, Nairobi, as I alluded to earlier, leads with 136 cases, followed by Mombasa with 32, Kajiado 13, Kiambu 7, Busia 5, Nakuru 4, Machakos 4, Garissa 3, Isiolo 3, Taita Taveta 2, Kitui, Migori, Narok, and Embu have 1 case each. The distribution of the new cases by sub-counties is as follows. The 136 cases in Nairobi come from Dagoretti North, 36, Westlands, 25, Kamkunji, 17, Kibra, 13, Makadara, 11, Starehe, 8, Langata, 9, Kasarani, 6, Embakasi East, 4, Embakasi North, 3, Ruaraka 3, and Embakasi Central 1. Second leading county is Mombasa, and the cases today come from Mvita, 20 cases, Likoni and Kisauni, 5 cases each, Changamwe 2. In Kajiado, the 13 cases are from Kajiado Central, 7, Kajiado North 5, and Kajiado West 1. In Kiambu, the 7 cases are from Ruiru 4, Kiambu Town 2, and Lari 1. In Busia, the 5 cases are from Teso North, 3, and Teso South, 2. The Nakuru cases are from Naivasha, 2, and Gilgil, 1. Machakos cases are in Athi River, 2 cases, and Machakos Town, 2 cases. In Garissa, the cases are from Dadaab, 2, and Garissa Township, 1. In Isiolo, the 3 cases are from Isiolo Town. The 2 cases in Taita Taveta are from Voi, the 1 case in Kitui from Kitui South, the 1 case in Migori from Suna East, and the 1 case from Narok is from Narok North, and the 1 case from Embu is from Manyata. On a positive note, we have today discharged 106 patients from our various hospitals, bringing the total cumulative number of recoveries to 1,459. We continue to appreciate the good work that our healthcare workers are doing out there. At the same time, regrettably, we report that we have lost 10 more patients to the disease. This is the highest number of fatalities recorded on a single day since the first case. And this brings to 117 the number of those who have succumbed to the disease. I want to send my heartfelt condolences to the families and friends of the departed.